Thank you very much. Dr. Sudhir Agarwal, who is a charter member of TiE, is going to introduce Dr. Pariksith Singh, who would be awarded for TiETan of Healthcare Entrepreneurship, and we are very proud of him being a community leader, and we sincerely feel that he is entitled and he qualifies for this award. So Dr. Agarwal, please.
This is my privilege to introduce Dr. Singh. Dr. Singh is board certified in internal medicine. He went to medical school in Sawai Man Singh Medical College in Jaipur, India. Then he did his internal medicine residency at All India Institute of Medical Sciences in New Delhi. And after that he came to Mount Sinai Medical School and did his internal medicine there. He graduated from medical school in 1992. He came to Florida in 1996. In 2001 he started Access Healthcare, and which now has more than 130 providers. It has primary doctors, sub-specialists. I know Dr. Singh in person. He's very, very hardworking, very humble. I have seen him making rounds at 4 o'clock in the morning in the hospital. I have seen him seeing the patients in his clinic. And seeing the patients in his clinic at 7 o'clock on Friday evenings. He is always willing to come and help his colleagues, when they are sick or when there is an emergency. And in spite of managing this big organization, he is has one of the biggest practice in Tampabay area. His doors are open to every patient. Any patient can walk in. He gives very personalized care to the patients. I have a lot of common patients with him. They are very, very satisfied with his care. And despite being very busy in his medical practice and this Access Healthcare organization, he's a lot of other hobbies. He writes poems almost every day. I have seen his poems on Facebook almost on daily basis. And one time I went to Jaipur, where we are from originally. I'm from the same town where he's from. And we went to the same medical school. And his dad, one time I went to Jaipur, I met him, and he sent 10 books with me for him, and they were all on literature and religion and poems. So he has a lot of other interests. He has a lot of interest in religion, literature, and philosophy. He's excellent physician. He is a very, very good community leader. His wife is a very busy internist, Maria Escanjano. He has 4 children. He has time to spend time with his kids also. I don't know when he rests. He just works tirelessly. I have seen his emails written at 3 o'clock in the morning. You just call him, he will pick up the phone, he will answer it, and I just have, all the good things to say about him.
I have known Dr. Singh for a while. Truly, he is an inspiration to a lot of us, and what he has achieved in his short span in the Tampabay area is very commendable, contributing both on the healthcare side and on the philanthropic side. And it's indeed a privilege for me to present this plaque to Dr. Singh, Pariksith Singh.
Thank you, Dr. K. Thank you, Dr. Myers. Kunal, thanks everyone for inviting me. It's always a pleasure to be talking to physicians and non-physicians about medical issues. This is the first time I've gotten an award for talking. It's good to receive it from someone I've learned so much from. Dr. K was, when Kunal sent me an email, we would like to nominate you, I said, there's no point, don't even bother, because Dr. K will win the award. So I said, next year maybe I'll try. So he says, no, Dr. K cannot get the award because he's the one who is chairman of the board. So he's out. So I said, if he's out, then I might have a chance. So I sent my resume in, and this today, I guess he confirmed it, that I was getting an award. It's a heavy, it's pretty heavy. It's a good sense. There's a lot to be done in the medical industry. More and more we see, as Dr. Myers has pointed out, there is so much need for innovation. I essentially agree with everything he's saying, but I think at some point we just have to also learn to take a step back and forget everything we have learned. Sometimes we get bogged by too much knowledge and too much information, and a good entrepreneur and a good innovator just learns to take a step back and looks at the whole picture objectively, in an objective manner. What happens is we get too tied up with the system, too tied up with ourselves, and we are, of course, the perfect ones, and everybody else is in a bad shape, and everybody has to practice like us. But if we take a step back, then we can see our own limitations, our own deficiencies, and how the system would get better if we got out of our own way. If we can figure that out, and if we can make it simple, a lot of things in medicine are very simple. And if those simple, basic processes can be followed, and a few very basic goals can be all agreed on, and we can reach those or attempt to reach those, I think it will be much easier to innovate in the medical industry. And Dr. K has done that multiple times. In fact, a serial entrepreneur is the word that applies to him very well. So I think we all innovate in our practices in a little way every day. We figure out new things with patients. Let's learn to take a step back and see if we can figure it out for the whole system. Then we will be truly entrepreneurs, and we'll be contributing much more to our medical field. Thank you.